What is Duke Integrative Medicine? Our vision is really to serve as a catalyst in the transformation of healthcare. That's why we exist. We don't exist so that Duke can have a clinic where people can get acupuncture, although that's important and that's good. Our real vision and mission is, can we model new approaches to healthcare and then translate them into the main system? So our reason for being is to be this living laboratory. An innovation engine is another way to say that. So we create and translate our ideas. We create our ideas, and then we want to translate them into the large system. Success for us is actually that integrative medicine disappears completely as a concept because it will have become the mainstream approach to healthcare. So this is not about creating a subspecialty of physicians, for example, that are trained this way. That's actually counter to exactly what we want, because we're really saying medicine as it is right now does some things very well and has some serious limitations, and we're at a place in the history of medicine where we can shift that in a significant way, and that's our goal. That's our goal. So that's a big picture of integrative medicine, and you'll see that this space is a living laboratory too. We had the opportunity to build from the ground up a place that would be, what would healthcare look like if it were in a space that were about healing? You know, what does that look like? What does it feel like? As you see the space, it's a little bit of a metaphor for the model in that out of 26,000 square feet, we have 5 physician rooms, and that is it. It's not because we forgot to build the physician rooms. It's because it's not a physician-centric model. You know, it's about learning and much broader approaches and developing tools for ourselves, et cetera. So, kind of coming back to where we are currently, contemporarily, and where we're headed. And again, goal would be that eventually this isn't even called integrative care. This is just current state of healthcare, future healthcare. So right now, very disease-focused. Well, we need to still do disease care well, but we want to shift this to health orientation, which doesn't just mean the absence of disease. So when I was in med school, I swear this is true, to my recollection, no one in 4 years of med school and 4 years of residency ever talked to me about health. Ever. Not as a concept, not as how do we help people achieve it. It is not on the radar screen. Pathology is on the radar screen. But optimal health, what does that mean to be optimally healthy to someone? You know, whether or not you're in a dying process, you know, what does that look like? So we're not going to just find and fix problems. We're going to identify risk and minimize the chance of that happening in the first place. We're not only going to offer biomedical interventions, we're going to talk about whole person approach. There's a lot of tools we can offer people in addition to drugs and surgery. This means we're not going to be reactive. We'll be reactive when we have to. You know, if you have acute chest pain and you come into the ED, you know, we'll respond. But we're going to be actively in the proactive way with you along the way. That means rather than having sporadic interventions, because I'm only seeing you when you're sick or you have a problem, we're actually going to do a process of lifelong planning, like that baby at birth. And here we go. Instead of having the individual, you know, lose weight, exercise more, see you in a year, let me know how that turns out, kind of, you know, you're on your own. We really, really need to figure out how to support people in implementing the plan they want. What does that look like? How do you do it? And what's going to happen is this is going to shift it from a physician-directed or physician-centric model to a much more partnership-based model.